Welcome back to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, as with just about everything these days, the internet and improving technology is changing the way people can get dental care. So I'm back with State Dental Health Officer Dr. Antonina Capurro. Thank you again for coming on the show.
Of course.
So one of your big priorities in this office was kind of increasing access to dentists, and one of the ways you're doing that is with this guy right here. So tell me what this is and why it's a thing.
Sure. So like we talked about before, increasing access to care is one of our missions. And really, we have to start thinking differently. Patients aren't coming to a brick and mortar office anymore. They want things that are more convenient. So we're trying to bring the dentist to them. Outside of the dental chair, it's kind of healthcare beyond walls is what we're calling it. And so we have our emergency room redirect project right now with a local hospital in Southern Nevada. And what we're trying to do is reduce the number of non-traumatic dental conditions that come to the emergency department. This is really a huge expenditure across the nation. So it's estimated that it's $90 million a year that's spent across our country in emergency room visits for dental conditions.
Wow.
That could have been avoided by going to the dental office. So it's not a fall, it's not a trip, it's something that could have been prevented earlier on if they had gotten treatment early. And so our dental benefit administrator, Liberty Dental Plan, has an after-hours emergency consultation service that they're using. So they contracted with teledentistry, which provides a live dental consultation with a licensed dentist, a licensed Nevada dentist, right in the comfort of your own home. And so what we've done is we've taken that technology and we're putting it in the emergency department. So if you do come to the emergency department, instead of just getting a prescription for maybe an opioid painkiller and an antibiotic, now you can actually speak with a dentist, identify the problem, and then there's a care management team on the back end that will help you get a dental appointment. And we're doing this for patients with all insurance types. So it's not just focused on Medicaid, it's for indigent patients as well as those that have private insurance.
So that way you don't have to pay the $250 copay, say you do have insurance, to go to the emergency room for something that you don't really need. It's not necessarily an emergency.
Right.
You know, you're going to end up needing to go to the dentist anyway.
Right.
So
and that's the problem.
The middleman there.
That's the problem, is the emergency room is not providing that definitive dental treatment that you need, but they're the safety source for patients that have nowhere else to go. And like we talked about earlier, within our Medicaid system, adults do have access to emergency services. They can get extractions and they can get an exam. But if they don't have a dental home, if they don't know that that's available to them, they're going to go to the emergency department.
Right.
And so by implementing this technology, this is something they can access in their home before they go there. And so we're trying to reduce that cost and kind of the burden as well on the emergency departments that have other issues that they need to focus on.
Yeah, so we logged in here, you make an account, log in just like you would any website really, and you can see the options. You can upload your medical documents, pay for your consultations, you know, maybe take a picture of a situation you're dealing with, even get a recommended dentist, right?
Right, so what you can do is, and this again is available in our emergency room redirect project, after they've seen the triage nurse, they've seen the physician, this is a consultation that they'll have with the dentist. So there's a live consultation, they'll talk with the dentist, they can take pictures of the area that's bothering them so the dentist can see a little bit closer what the issue is, and then based on that, they'll give them a recommendation. And they can prescribe right from here, they can call it into your pharmacy, your antibiotics, and they do not prescribe opioids through this system, so it's another way to reduce the epidemic that we have with opioid prescriptions that are being prescribed in the emergency department.
All right, so we're going to go ahead and request our consultation now, and we've done this already because we wanted to show you how it works. So we're going to head on over and show you. You request the consultation, it basically turns into a web conferencing. So step on over and we can see we've got Dr. Vilas here standing by, ready to consult with us, which is pretty cool. You know, we basically just clicked a button and we have a dentist, a licensed dentist right here ready to answer our questions. Dr. Vilas, are you there?
Yes, I'm here. How are you doing today?
Good, good. It looks like we have your audio, but your video might be a little bit frozen. So we're still going to go ahead and ask you our questions. So say I'm a patient and I've got, you know, say a chipped tooth or something. I, you know, bit into an ice cube or something. Is that something that you will get from, you know, like the patients who conference with you?
So if you're a patient who's having a dental emergency, then what we're able to do is have a look at what's going on inside your mouth through the video conferencing system, and then basically do an initial assessment and then recommend treatment accordingly, and even provide you with an e-prescription for an antibiotic, as well as some kind of a method to alleviate the pain, so to speak.
So
and
then,
that's all sent via
would I like upload a
pharmacy.
photo to show you? Is that how that works, or do I just like get real close to the video camera here and show you the inside of my mouth?
So we can do, you can submit photos, and we can also do video conference like we're doing right now. And both of those methods work just great in terms of being able to provide access to care to a dentist. Yeah.
All right. Well, Dr. Vilas, thank you so much. I really appreciate you video conferencing with us from the other side of the state. Technology, ladies and gentlemen, it's a pretty cool option, right? Yeah. So we'll go ahead and sit back down so everyone can kind of think about that, and we'll talk about some of the other things that you guys have going on in your office aside from the teledentistry. It's not the only thing. You mentioned earlier when we were talking about some of the health issues that can coincide with dental problems, and one of those is diabetes. And I know your office is working on kind of increasing care for diabetic patients who are also having dental issues.
Right, and so it's kind of a timely issue because November is Diabetes Awareness Month. So it's a time for everyone to kind of reassess if they have those risk factors for diabetes, if they need to be tested and then treated. So we follow national guidelines, and one of those is the Healthy People 2020 guideline on reducing the number of adults that have a permanent tooth that's extracted because of dental decay or because of periodontal disease. So we're trying to meet that goal, and there's about an 8% decrease in the number that we need to meet, which is pretty significant. And so what people may not realize is that, of course, the oral health affects overall health, and especially in patients with diabetes, they're predisposed to periodontal disease, which is the loss of bone and tissue surrounding the teeth. It's so common that periodontitis has been called the sixth complication of diabetes.
Wow.
And so we want to do everything we can to avoid this inflammatory response in the body.